Hello, I'm Nick Caricato with Norton Healthcare. Here at Norton Healthcare, we do emergency drills quarterly. Today we're going to do an OB postpartum hemorrhage emergency drill. A little bit of background on our patient. This is a 24-year-old gravid 3-para-2 that just had a normal spontaneous vaginal delivery at term without any complications. The delivery occurred without any problems. The placenta delivered spontaneously intact with a 3-vessel cord. I walked out of the room. Our nurse is just coming back in 15 minutes later for her postpartum check, and here's what is going to happen.
Well, hey, Miss Akrita, how are you doing?
I'm good. How are you?
Good. It looks like you're enjoying your baby.
Yeah.
Yeah, congratulations.
Thank you.
Well, it's now time for us to start your postpartum check, so I'm going to lay you back. You can hang on to the baby there. You'll just bend your knees up just a little bit.
I think they're still a little heavy.
Well, I understand, so I'm going to help you with that, and I will be rubbing on your tummy. You might remember that from your other babies. Okay. Now, how are you feeling? Can you...
I feel like a lot's coming out.
Actually, you're right. There is a lot. In fact, it looks like a little more than we would expect. You want to make sure your IV arm is hanging down like that and your IV is running good. Okay. I think if it's okay with you, I'll go ahead and call the nursery and have them pick up the baby and Grandma, if you wouldn't mind going with them. Yes, is this room 1? I want to know if you'll come to labor and delivery room 5 and come and pick up the baby. Yeah, thanks a lot.
Got it.
And then if it's okay, I'm going to see if we can get a hold of our charge nurse, and she'll be bringing or notifying Dr. Caricato.
Is everything okay then?
Well, I think it'd be probably things will be just fine. But what we want to do is make sure that the doctor checks you out, and if there's anything else that we need to do. Okay? Yes, is this the charge nurse? I wondered if you would, if Dr. Caricato is at the desk, and if you guys would head on in here. I sure would like to have him check out our patient in room 5. Thanks so much.
Right? Can I look at your ID band? And I want to compare it with her.
And then I'm going to be taking more blood pressures.
Okay. Okay. I'm going with her.
Yeah, we'll be seeing you all later. Yeah. Okay. And I'm going to be rubbing on your tummy a little bit more.
Janice, what do we got going on here?
Well, I think that we have a little extra bleeding. I was hoping that Dr. Caricato could
He's
come
on
in
his way. We did call him.
Okay, excellent. And we got our IV going really well, so.
Hey, what's going on?
Hey, Dr. Caricato. I was a little concerned after her first postpartum check that she's got extra bleeding.
Okay, let's take a look.
I haven't cleaned her up, so I wanted you to see.
Yeah, it looks like I'm going to do some fundal massage. You got a little bit more bleeding than normal. We're just taking a look here, okay? And it looks like she's got about a liter here in the bed. We're going to go ahead and initiate stage 2 of the OB hemorrhage protocol.
Okay, and I noticed her heart rate is really jumped up. It's
What
like
is it?
130. Her blood pressure is lower than it was, so maybe 100 over 50.
Okay, we're going to place you up in the stirrups and try and figure out where this bleeding's coming from. Okay. Janice, we're going to go ahead and start a second IV, large bore. We're going to go ahead and call anesthesia. If you could place a Foley catheter.
Okay, I'll be doing that.
And we're going to draw some stat labs. We'll do a CBC, a type and cross for 4 units of packed red blood cells, a fibrinogen, coags, and if we could draw a red top tube and put it off to the side and just send it down the lab.
Okay, all right, thank you.
Okay. With you and we grab the meds.
I know. We'll be making sure that we take good care of you. We're looking after you really well. We've got our anesthesiologist, Dr. Malaysia.
What's going on?
Well, she's having some extra bleeding, Dr. J, and her heart rate's up. It's almost 140 now. Her blood pressure's falling. So Dr. Caricato is going to check to see where the bleeding might be coming from. He wants to initiate maternal hemorrhage protocol.
Okay, this is where Pedro's running still?
It is not running, but it's still in place.
Okay.
And she had good anesthesia.
Could you give me some blood so I can get this back on?
There you go. I know, so let's go ahead and get some oxygen on.
Let's go ahead and set that up.
Have your level labels.
And give her a bolus of about 1 liter.
Here's your blood. I'm sorry.
I need that one red top tube though.
I got it.
Okay.
Giving it to Kim.
Thank you.
Linda, do you want our blood bank page number?
Yes.
It's
excellent.
PPH458.
Would you repeat that, please?
It's
Here's some oxygen,
PPH458.
and then
Thank you.
Thank you.
you can just breathe normal. That's gonna make you feel a lot better. Okay.
We're gonna push on your uterus here. It still feels boggy, and looks like she's got another 500 of blood in the bed here for a total of 1,500. We're
Okay.
gonna go ahead and initiate stage 3 of the hemorrhage protocol. We could go ahead and get 4 units of packed red blood cells, 4 units of FFP, and 1 unit of platelets up into the room.
All right, would you like me to give you any of the medication?
Yeah, let's get her placed into the stirrups here first.
The order of our pack cells, 4 pack cells, 4 FFP, 10 cryo, and 1 unit of platelets, please. Thank you.
And Janice, while you're doing that, we can go ahead and give her 0.2 milligrams of Methergin IM,
Okay.
and we'll have the Cytotec ready.
All right.
Rapid infuser
You're having a
setup.
little extra bleeding. We just want to make sure that we take good care of you, so we're going to make sure we do everything we can to get this bleeding stopped for you, okay? Are you feeling okay?
Have you all sent for the labs already?
We placed the full lead.
The Foley's in place, and I also put a urinometer on,
Great.
okay?
This is Methergin 0.2 milligrams IM. And do we have the Cytotec?
I have it right here.
Great.
Okay, we're gonna scan that and scan.
Pushing on your uterus here to try and firm it up, okay? It feels a little bit foggy. We're giving some medicines to kind of help with the control the bleeding, okay?
Open the Cytotec here on your table.
I also have Hemabate if you decide we need to use that.
Thank you.
Okay. And then, are you feeling cold?
Our rapid
I'm gonna
infuser
get
is ready for when our blood gets here.
And here's the 800 micrograms of Cytotec. We're going to go ahead and place this per rectum.
Okay, now all that's gonna help is to
Your blood's
make
here.
your uterus
Thank you, Linda.
tighten so that you won't have.
Here's our blood. Thank you.
Okay, you might feel some more cramps.
Go ahead and check it.
Eunice, I'm
let
going
us
to grab
know.
and grab our bear hugger, okay?
Okay, great.
First thing we're going to do here is look at the cervix to make sure you don't have a cervical laceration, a vaginal laceration, or a hematoma.
Frida?
Place the right angle.
Okay, awesome. Okay, and then we're gonna be putting this on, and warming it up a little bit. I'm gonna put this under here.
She has no cervical, vaginal, or vulvar lacerations. She's got quite a bit of bleeding still.
Let me know when you're ready.
What's that
Our
first thing,
lights
Dennis?
turned on. 411. Our blood pressure?
Yeah.
What is 100/40. Our heart rate's climbing 135.
Thank you.
We're going to manually explore the uterus to
Okay,
make
go
sure you
ahead.
don't have any retained placenta or retained products. There's nothing left in the uterus. Your uterus still feels a little bit foggy. Can we go ahead and give the Hemabate 0.25 milligrams IM?
Yeah. And then we're gonna try to keep you warm there. Okay.
How much blood have you lost so far?
It looks like we're almost up to 2 liters. We're going to go ahead and place the Bakri balloon. Is the blood products going into the rapid infuser?
Yes.
Okay, the Hemabate is given, what time is it? All right, we'll take note and let you know.
Great. We have the Bakri balloon. We're going to place a balloon in here. Your uterus is a little bit boggy. It hasn't clamped down, so we're going to place a balloon in here to kind of stop the bleeding, okay? You might feel a little bit discomfort. Great. Here's the Bakri balloon. We're going to fill it up with 300 mLs of normal saline.
And I'm taking your blood pressure again.
Mom, come back there.
We're gonna let her, wait out in the waiting room, just in case we need to do some extra things. She might be uncomfortable.
Her continuous pulse ox is on. What's her latest heart rate?
It's 145, and her blood pressure is 90 over 40.
I'm going to read that.
Okay.
OB number PPH458. Right?
Okay, and her vitals are about the same still.
Patient ADO RH product O negative.
We'll go ahead and give the other unit of blood
Okay.
for the second unit.
1, 2,
Thank
3,
you.
4, 5, 6. Okay. 180 mLs. Okay.
It's been 15 minutes since the first methadone.
Can we go ahead and give a second dose of methadone, 0.2 milligrams IM?
All right, I got that right here.
The Bakri balloon is in. Looks like she still had about another 500 out for a total of 2,500 ml. We're gonna go ahead and set the operating room and take her back to
Can
the
you pause
operating
it,
room.
take please? Okay, her, tube that
Alan,
was
will
up
you
to
go
the
ahead
side
and
is
set up the
now
OR,
hot.
please?
Not for more than 10 minutes.
Her red
And
top
more
tube
dominant.
is not clotted in 10 minutes, okay? You're still having quite a bit of bleeding. We're gonna take you back to the operating room and reevaluate this situation, okay?
After the second unit, give her the last one.
When you all are finished with that 4th unit of Paxil, make sure you draw our second set of labs, a CBC, a D-dimer, our calcium, and a PT-PTT fibrinogen, please.
Okay.
Name and location.
Okay.
OB number PPH458. Right? ADO RH product O negative.
Get her down from the straps, so I'll take her back to the operating room.
All right.
Let's
put her
down
there.
80 mLs. Right? Expires 4/11/15 and 3/6. Right?
How's it going? Okay. Ready? I'm gonna draw labs real fast. Okay. We can cover it that way.
Okay, Miss Emma, I'm gonna do a real quick stick and draw some labs on you, okay?
Yeah, make sure both IVs are running.
Okay, IV on the right here is looking good.
I have your lab labels.
They're drawn now, thank you.
Okay.
Okay, second set of labs are drawn. If you see in here, I'll label them. Thank you. Thank you.
Okay, how are you feeling?
Yeah, again, take this epidural
Okay.
off.
Don't really like
Use
it.
the stand.
Okay.
There's gonna be a lot of people coming and going, and we're gonna get you to the OR, okay? You're in great hands. Okay.
Is
We're
there
gonna get to the OR, okay? You're gonna meet us there with PAPs and stuff,
I got a cap for her.
okay?
Okay, good. Put that on. I know you do that.
You wanna drop that arm right off?
Keep your hand inside.
Here we are. What's our room time?
We are in at 11:20.
Okay. And here's her right-handed IV.
Okay.
Lower it.
Yeah.
Careful.
Now you still be
Maybe
better.
still be better.
Are we close? I think you have to make the bed. Make the bed flat. Okay.
Go ahead and move her.
On the side, please.
1, 2, 3.
Okay. All right, I guess moving over here. Okay, when we say breathe, okay? So we ready? 1, 2, 3. Okay. Your hands up. Okay, good. Put the oxygen mask.
continue to massage her uterus here, okay?
Are you still bleeding?
She's still bleeding. It looks like another 500 for a total of about 3 liters.
Just go ahead and get the other 4 units of fat cells and 4 units of plasma.
Okay. We need a towel. Can you hand me a towel, please?
You're continuing to bleed. We're going to need to put you to sleep and do surgery to try and stop this bleeding, okay? There's a chance that we might have to do a hysterectomy in order to stop the bleeding. Are you okay with this?
Here she comes with the blood.
We're going to go ahead and open for exploratory laparotomy.
Here's your blood. Thank you.
Okay, her EKGs are on. We're gonna get some blood started.
Name.
Okay, so we need to count.
Let's grab it.
PPH 458. I can count if you need. Number W202 415
Okay, let's go ahead and count.
288.
Left,
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 16, 17, 18, 19, 20.
Okay, 20 left.
Now hold your hand, okay?
1, 2, 3,
Take nice slow
4,
breaths,
5,
in and out.
7.
Okay, do you have any injectable needles?
No injectable.
Blades?
Yeah, your baby's fine.
Okay, and blood needles.
2 handles on the back.
First
two
you have
handles,
double up.
2 blades on the handles.
Okay, and our instruments?
4 needles on the back.
Okay,
3
Carl.
crowd. 2 backpacks on the back.
Okay.
1, 2, 3, 4 pickups on the back. 1, 2 up. 2 cokers. 1, 2. Alex. 1, 2, 3, 4.
Okay.
Kelly. 1, 2, 3, 4, 5, 6. 3 crowd. 1, 2, 3. 1, 2, 3 on the back.
Okay, thank you.
Are you dry? Wet? Wet?
This is Dr. Baker. He's going to be assisting me, okay?
Hi there. How you doing? Take good care of you.
Janice, can I get some 7?
Yeah.
What's the heart rate now?
Still down.
And our red top tube never clotted after 10 minutes.
It did not ever clot, no.
Our Bakri balloon's still in place. It looks like she's lost at least 3 liters so far.
Let's keep on going, giving the blood, please.
Another year? Are we ready to pump?
Go ahead and press.
Okay, she's prepped. Okay, ready?
Okay, dear, you're gonna go ahead and,
Okay.
you're gonna go to sleep now, okay? Take nice slow breaths, in and out.
4, 1, 5, 2, 2, 3, 3, 3, 3, 2, 8, and out. 5, 12, 15, 3, 2, 3, 2.
Okay.
Okay, the patient is intubated.
Great. We're going to now perform exploratory laparotomy through a midline vertical incision. Scalpel.
Dr. J, I think we need another access, so go ahead and place in the center line, and I will place in the A line.
Okay. You got center line here. Okay.
Our Bakri balloon is still in place. She's still having significant bleeding through the Bakri balloon, central lumen channel.
And her urine meter only has 10 cc's output,
10 cc's out.
since I put it in before we started.
Okay, she already had a central line and an A-line placed, and we're still giving the blood.
Great. We're going to start with bilateral uterine artery ligation. Can I have a stick, please? Thanks, Dr. Baker.
Hey, Debbie, how much blood is going to go for?
How much blood have we given? Okay.
Remember, after every 4 units, we need to draw our 4 sets of labs, a CBC, a PT, PTT, a
Somebody push this over
fibrinogen, and a
to me.
calcium.
Sure. For the lab.
Okay.
How much plasma have we given?
1 of the plasma, 3 of blood.
Go ahead and give some more plasma, please.
Okay.
So this is another PETA, OB number CPH458, count number 700000653.
All right, we've now ligated bilateral uterine arteries. How's her heart rate doing?
Fill up. Blood pressure is low.
How many units of blood has she had so far?
How many blood?
We got already 5 units of packed cells and 4 units of plasma. We're giving the 6 units, the 5th unit of plasma and the 6 of the packed
I
cells.
give it some cholesterol.
Later, sorry.
And we drew some labs, we sent them down.
Okay.
All right, we're going to try a B-link suture. It's a compression suture of the uterus. We can do it while the Bacri balloon is still in place.
Do you see any clot in the field? Is she clotting at all?
No, she's still very, very oozy. Blood is very thin.
Do we have any labs back?
We've sent for them.
Uterus is still very boggy, not clamping down at all. Go ahead and give another, if it's been 15 minutes since the last dose of hemabate, go ahead and give another 0.25 milligrams of hemabate, IM.
Okay. I've got that, and I can give that. It's given.
And whenever the last dose of metrogen is, if it's been 15 minutes.
Our last set of labs are back. Our hemoglobin is 6. Our fibrinogen is 70. Platelets are 70 as well.
Thank you.
Yeah, PT, PTT.
Those are not back yet.
Okay, thank you.
And it's been 15 minutes, I'll give another dose of metrogen.
Is this the second?
So do we still
Yes.
have plasma in the room or packed cells in the room? How many do we have in the room left?
We should have 1 more pack cell, 1 more pack cell, and
So send for another 4 units of packed cells and 4 units of plasma and 1 pheresis pack of platelets
Linda, we need more pack cells. We need 4 more units of pack cells.
and
4
10
more
units of cryo.
platelets.
I'm a PETA,
Or 10 units of cryo,
458,
please. Thank you.
O negative, account unit number W202415233.
Ready for it.
333.
Can you call and check, please? You need a his set.
E0336.
I need a tag.
Our bilateral uterine artery ligations have not worked. Our B-link suture compression suture has not worked. We're now going to perform a supracervical hysterectomy to control her bleeding. We're going to take the Bacri balloon out.
Okay.
Our next cooler of blood should be here any minute.
Thank you.
Okay,
You're welcome.
all right. So I've got the Bacri balloon now.
Okay, go ahead and check the blood.
We're now going to perform a supracervical hysterectomy.
Name, I'm a PETA,
While
X0000.
we're continuing to give blood products.
PPH458. O negative, unit W2024151. 280
You need more labs. Yes, more labs, please.
336.
So have we sent for new sets of labs?
After the next one, we'll send some more labs.
Okay.
Dennis, I have 1 2, 3, 4, 5, so 25.
Okay, 25, last. We need to count those instruments.
I have 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 6 pokers.
Name, I'm a
3
clear.
hangings, 1, 2, 3, 1, 2, 3, 4 right angles,
4, 5, 8.
1 D.
Oh, negative, and then negative. 2, 0, 2, 4, 1, 5, 1. 2, 3, 4, 5, 6.
Okay, got that.
4, 11, 15, E, 0, 3, 3, 6.
Adding the valve.
Okay,
For our next blood draw.
got that.
Do you know if anyone's called the chaplain to go be with the family?
I can have Linda make sure that happens. Linda, can you make sure that the chaplain's been called and to let her know that the grandmother should be with the baby somewhere near the nursery, maybe in the waiting room? Thank you.
Okay, I'm gonna send these labs.
Thank you.
When I love them.
Valve port. We've now performed our supracervical hysterectomy. The bleeding has stopped. Here's the uterine specimen. We saved her ovaries.
You have a bucket, Allie?
So are we gonna send anything to Pat besides the uterus?
Just uterus. Placenta should have been sent earlier.
Okay. Will do.
Dr. Caricato, where do you want her to go after we get her sewn up?
She's going to the ICU.
Let me call for then.
How much total of blood
Yes,
did
this
you
is
get?
Emily in labor and delivery. We have a patient and we've just had to perform an emergency
You wanna
histology for
count?
postpartum bleeding.
Yep.
If we could get an ICU bed, we are finishing up in the OR.
How much
Thank you.
blood products did she receive?
I have 1,
You got 8 units.
8 units of packed red
Two
blood cells. How many of
packed
FFP?
4, 5, 6, 7,
10 of FFP.
8,
And 2 units of platelets?
11,
Great.
12, 13, 14,
And is her heart rate coming back up? Blood pressure stabilized?
19, 20,
Yes.
and 1,
The heart rate
22.
is,
23,
down,
24,
blood pressure is
25.
improving.
We don't have any significant oozing down here, so we're going to go ahead and
Right.
close.
I see
Okay,
two.
thank
I
you.
have 1, 2, 3, 4, 5, 6, 7 sutures,
Okay, 7.
1, 2 needle holders. Oh, and then I have pickups, 1, 2, 3, 4, 5. Yeah.
Okay, so our patient is stable. She's going up to the ICU. She's extubated. She did have to have a supracervical hysterectomy as a last resort. Interesting, the final pathology showed an undiagnosed focal accreta. That was why none of our other uterine conservative measures did not work. So we did have to take the uterus. Overall, she got 8 units of packed red blood cells, 10 units of fresh frozen plasma, and 2 units of platelets before she stabilized. We first started out giving her 0.2 milligrams of methogen. She got 2 doses of that. She got 800 micrograms of rectal cytotec. I believe she got at least 2 doses of hemabate. She had the Bakri balloon placed, which did not work. Once we decided to perform a vertical midline laparotomy, we tried uterine conservative measures first. Tried to save the uterus. It did not work. We started with a bilateral uterine artery ligation, which did not work. Then we went with the B Lynch suture. Both those were done with the Bakri balloon in place. We removed the Bakri balloon after that did not work and performed a supracervical hysterectomy. Once we performed the hysterectomy, she stabilized. They were able to adequately resuscitate her, and her labs came back to normal 2 hours after her surgery. She was extubated in the ICU and is doing well. Should go home on post-op day number 4.